Developing effective COVID-19 vaccines was one challenge, but it wasn't the only hard part. Getting millions of people vaccinated will be a monumental task. Here in Texas, our first shipment is expected to be roughly 1.4 million doses across the state. Bexar County alone has a population of around 2 million.
This is really just the start. It goes through a process. It's rigorous. It's absolutely as rigorous as any we've done in history. So I'm confident in it, but it's still just the beginning of rolling out a massive campaign for vaccination.
Because vaccine supply will be limited, a Texas Department of State Health Services panel laid out who will get the first shipment of doses. Healthcare workers will be first in line. The panel has these workers separated into two tiers. The first tier includes hospital staff working directly with COVID patients, as well as long-term care staff at nursing homes and assisted living facilities. EMS and home healthcare workers who have direct contact with high-risk patients are also in this group. There is a second tier if there is enough of the first supply remaining. This tier includes staff in outpatient care offices and freestanding emergency care facilities, pharmacy, and public health staff who administer COVID tests and vaccinations, and school nurses. The distribution plan is fluid, but the state wants to make sure it's prioritizing populations that have a greater risk of severe illness if they contract COVID-19. Another goal is to lessen the impact of the virus in areas that have existing health inequities.
I think it's a process of constant reevaluation. So right now, I think a lot of individuals are focusing on first responders and healthcare providers and trying to see the number of vaccines that get provided for them. But we really do need to think about those other settings and protecting that other community.
Over the next month, Texas health officials will look at the latest case data to find where there might be COVID hotspots flaring up. Bexar County is expected to get around 28,000 vaccine doses at 11 healthcare facilities at first. Governor Greg Abbott says a second shipment is expected in January. If all goes as planned, some of the people not included in those first two tiers may be able to start getting vaccinated by the spring.